Hi, I'm Dr. Sherwin Hua. I'm a neurosurgeon. I've been in practice for 20 years, and my practice is called Dime Spine Neurosurgery. Today we're here to talk about sacroiliac pain, or SI pain, and SI fusion. The SI joint or sacroiliac joints are part of the pelvis. The pelvis is made up of three bones, the two iliac bones and the sacral bone in the back. The SI joints move just slightly enough that it serves as a shock absorber so that the weight of the upper body and the movement can be transferred to the legs and then to the ground. So I became interested in learning more about the SI joint because we realized that SI pain is up to 15-20% of people with back pain and maybe 40% of people who've had previous lumbar fusion surgery too.
Hi, I'm Nisha Jariwala, and I work as a neurosurgical physician assistant for Dime Spine Neurosurgery. SI patients usually describe their pain as low back pain that is below the belt line. When I hear patients complain of low back pain that is worse when rising from a seated position, triggered with climbing stairs, worse with prolonged sitting or standing, as well as worse with unilateral weight distribution, that is when I start suspecting that their low back pain may be arising from the SI joint.
So during the clinic visit, how we find out that the patient has SI joint pain, first we do the history, of course, and then we go into a physical exam, and specifically we do a series of tests called the provocative test of the SI joint. And these are 5 tests that are specially designed to cause pain from the SI joint.
When multiple SI joint maneuvers are shown to elicit SI pain, we send our patients for a diagnostic SI joint injection to confirm this.
They will numb up the SI joint and then see if the pain gets better. When a patient gets the injection and actually has a positive SI block, then that confirms that the patient has pain localized from the SI joint. And so next, we need to treat the pain. Not all SI joint pain requires surgery, so we try anti-inflammatories, a period of rest. There's some strengthening exercises that physical therapists will teach to strengthen the SI joint. But for those that don't get better, they might need surgery. So how the SI joint fusion is performed, we have the patient laying flat on their belly, and we approach from the side of the hip area. And the incision is about 1 inch in size, so it's very minimally invasive. We go in between the muscle fibers, and then using x-rays, we localize the trajectory precisely, and then we just place 2 to 3 implants that cross the SI joint, thereby stabilizing it. The aftercare, patients do have to use either a walker or a cane for about a month because we want to protect that joint while it's healing. But after that, the patients notice that the SI joint pain that they had before is gone.
A lot of our patients who do undergo SI fusion surgery for stabilization of the SI joint have found that their back pain has improved and diminished to a point that they are able to resume a good quality of life with functional improvement. And I think that a majority of patients who do exhibit SI pain do have significant functional outcomes.
I have patients who come either to me or one of my staff, Nisha, my PA. Sometimes she'll call me and say, "Hey, do you remember that patient? She just came and said, wow, her pain is gone." And we'll go, well, wow, that's great. So the SI joint is one of those areas where the pain can be treated very effectively.